Hello to all of you, to families and friends. I very much regret not being with you in person for this weekend in Charlotte for this first JdVS Support Group Conference. You have all done such a fantastic job first forming this support group that is growing daily and now successfully planning a fun and educational program for all of you. I'd like to share with you a few bits of history on my adventure with JdVS and how I came to study this syndrome for the last several years. I first met Daniel at our Kern Regional Center clinic in Bakersfield, California, when he was about 2 years old. He was the cutest, sweetest, most outgoing child I'd just about ever seen. We did our usual genetics workup available at the time, and everything was negative. I saw him again in follow-up in Bakersfield, but again, no diagnosis. Then in 2015, he was re-referred because his teachers thought he might have Williams syndrome. Indeed, his outgoing personality, his tendency to repeat things, and his overall demeanor suggested this diagnosis. We knew it was not straightforward because we had ruled out the most common causes of Williams, but we thought, well, maybe it's something tiny within the Williams region. So we decided to pursue exome sequencing. I know this is a test that most of you have heard of because it is how many of your children were diagnosed. Back in 2015, it was still a bit new clinically. However, the testing was again reported as negative. Then in 2017, we received a revised report reporting a variant in the gene PPM1D, the gene that we knew was responsible for JdVS syndrome. This had been reported in 2017. We were very excited. We had a diagnosis at last. We also realized that we had a lot to learn about this syndrome. Bert DeVries and his many wonderful colleagues had noticed most of the findings important to the syndrome, but we felt there was more to know, and the families were asking for more. Thus began my adventure with this syndrome and meeting some of the cutest kids and nicest parents ever. I have since met with many of you on Zoom, by telephone, by lots of emails, and in person. We have seen families from all over the US, the UK, Australia, and New Zealand. 3 of you are my patients in Fresno. I have even met a few families at a local playground near Carmel, California. I can't tell you how much I appreciate all of your time and your commitment to help doctors understand this interesting syndrome and to help you help your kids. In about 2020, I met Dr. Monica Wojcik from Boston Children's at the David Smith meetings. I enjoyed her talk so much and went to talk to her afterwards. We had many interests in common, and I said, would you like to work with me on this? Because I needed a younger colleague. Thus began a friendship and collaboration with Monica, who did the heavy lifting to get this paper out in May of 2023. She did an awesome job. Thank yous to Monica and to all of the other wonderful clinical contributors. My impressions of JdVS are many. These children are cute, extremely loving, and everyone enjoys them. Problems with anxiety, visual perception, and GI issues are common in young children. And unfortunately, as these children get older, often undiagnosed cyclic vomiting and migraines are relatively frequent problems for which there are no good answers. Managing these distressing symptoms is another topic, and despite the efforts of many clinicians and suggestions from many of you, I don't think we have perfect answers. Hopefully, we will have these answers from other investigators in the future. Many best wishes for a wonderful conference. You will have new and old friendships and will gain many insights over these next few days. Thanks again for all you do for your children and your commitment to help them and so many others in the years ahead.